If you've been living with lower back pain for weeks, months, or even years, and you've tried stretches from the internet, maybe a heating pad, maybe something a friend suggested, and none of it has really helped, you're not alone. And more importantly, you're not out of options. What we commonly see in our clinic is that most people haven't been given a clear explanation of what's actually happening in their back. They've been handed exercises without context, and without context, it's very difficult to stay consistent or to know whether something is helping or making things worse. Today, we're going to walk through 3 exercises that physical therapists frequently use as a starting point for lower back rehabilitation. We'll explain the anatomy, the purpose, and what to watch for. Whether these are right for you specifically, well, that depends on your individual situation, but understanding them is a reasonable first step. Exercise 1. The bird dog. It targets something called spinal stability, which is different from simply having a strong core. Let's talk about why that distinction matters. Deep within your lower back, running alongside each vertebra, is a muscle called the multifidus. Its job isn't to move your spine dramatically. It's to hold each segment in place, moment to moment, like a series of small anchors. When this muscle becomes inhibited, which research suggests can happen relatively quickly after a pain episode, the spine loses some of its natural support. The bird dog trains this system, starting on hands and knees. The goal is to keep the spine completely still, not arched, not rounded, while slowly extending one arm forward and the opposite leg back. What we're asking the nervous system to do here is maintain stability under a small, controlled challenge. The movement itself is almost secondary, the spine staying still. That's the work. Hold for about 3 to 5 seconds. Lower slowly. Repeat on the other side. Most people start with 2 to 3 sets of 8 repetitions. If you feel sharp pain or significant discomfort, that's a signal to stop and consult with a provider before continuing. Not everyone tolerates this position immediately, and that's useful information. It tells us something about where your rehabilitation might need to begin. Exercise 2. Modified glute bridge. To understand why this matters for lower back pain, we need to look at what's called the posterior chain, the connected system of muscles running along the back of your body. Your gluteus maximus, the large muscle of your buttock, connects through a thick sheet of connective tissue directly to the lumbar spine. When the glutes are underactive, which is something we commonly see in people who sit for extended periods, the lower back muscles are often compensating. Over time, that compensation can contribute to fatigue, tension, and pain. The bridge asks the glutes to do their job, to extend the hip and lift the pelvis, while the lower back remains relaxed. That's the key distinction here. We pay close attention to what's called anterior pelvic tilt, a forward tipping of the pelvis that's quite common. When the bridge is performed correctly, the pelvis should move with a degree of control and neutrality. If you notice your lower back arching significantly as you rise, that may indicate the glutes aren't fully engaging. This isn't about perfection on the first attempt. It's about building awareness. Start with a gentle lift. Hold 2 to 3 seconds. Lower slowly. 2 sets of 10 is a reasonable starting point for most people. Again, if this creates pain rather than mild muscular effort, it may not be the right starting point for you specifically. Exercise 3. Active child's pose, where the first 2 exercises focused on building support and strength. This one is about creating space. When we bring the lumbar spine into a supported forward flexed position, as happens in child's pose, a few things occur. The facet joints, which are small joints at the back of each vertebral level, gently open. The muscles along the spine get an opportunity to decompress. And for some people, there's a meaningful reduction in the compressive forces that build up with prolonged standing or sitting. We call it active because the arms are gently reaching forward, not just passively resting. That reaching creates a mild traction effect through the thoracic and lumbar spine. It's a small distinction, but a meaningful one. Hold this position for 30 seconds to 1 minute. Focus on slow, relaxed breathing. As you exhale, you may notice a slight deepening of the stretch. That's a normal response to the nervous system relaxing. It's worth noting that child's pose is not appropriate for everyone. People with certain knee conditions, hip restrictions, or specific types of disc pathology may find this position uncomfortable or inadvisable. That's another reason individual evaluation matters. If you feel relief in this position, that's informative. If you feel increased symptoms, particularly down the leg, stop and note that for a provider. 3 exercises, 3 different purposes: stability, posterior chain activation, and decompression. None of them are a cure. None of them are guaranteed to resolve your pain, but each one is grounded in how the spine actually functions. What we've found, working with patients over many years is that the people who make the most meaningful progress are often the ones who start by understanding their body, not rushing toward the quickest fix, but building a foundation of knowledge first. If these exercises feel right for your situation, approach them with patience and consistency. 2 to 3 times per week, with attention to how your body responds, is generally more useful than doing them intensely once. And if you're unsure, if you have questions about whether these are appropriate for your specific condition, that uncertainty is worth taking seriously. A proper evaluation can give you clarity that no video can. You've spent time today trying to understand your back. That's not a small thing. When you're ready to take the next step, whether that's a second opinion, a more detailed assessment, or simply a conversation, we're here for that. Take care of yourself.